Are you experiencing stiffness or swelling around your joints? Are you unsure of what may be causing this discomfort? This video will explain the different types of tendonitis so that you can narrow down what may be causing your pain and help you start your journey to release. Hi, I'm Jason Ujimian. I'm a licensed physical therapist at EW Motion Therapy in Birmingham, Alabama. I treat patients who have tendonitis all the time. In this video, I'll explain the most common types of tendonitis, symptoms, and options to help you start treating your tendonitis so that you can get back to doing what you want pain-free. Tendonitis can affect any tendon in the body, but some types are more common due to the frequency of use and the stress placed on specific tendons. Let's talk about some of the most common types. Achilles tendonitis affects the tendon connecting the calf muscles to the heel bone and is most common in those who run or play sports that require jumping. Patellar tendonitis, also known as jumper's knee, affects the tendon connecting the kneecap to the shin bone. This condition is common in athletes involved in sports like basketball or volleyball, where jumping and landing put stress on the knee. Tennis elbow is a condition that affects the tendons on the outside of the elbow. It can be caused by repetitive wrist and arm motions and is common in tennis players, but can also affect other individuals who perform similar repetitive movements. Rotator cuff tendonitis involves inflammation of the tendons in the shoulder. It is common among people who perform repetitive overhead motions, such as painters, swimmers, and baseball pitchers. De Quervain's veins tenosynovitis affects the tendons of the thumb. This is most common in individuals who engage in repetitive hand or wrist motions, like new moms, musicians, and people who work on assembly lines. Peroneal tendonitis affects the tendons that run along the outside of the ankle and foot. It is common among runners, hikers, and individuals who engage in activities that involve repetitive ankle motions or sudden changes of direction. And finally, bicipital tendonitis affects the tendon that connects the bicep muscle to the shoulder and elbow. It is most common in individuals who perform repetitive overhead activities. Let's review common symptoms and risk factors for people with tendonitis. The symptoms of tendonitis can vary depending on the location and severity of the condition. Common symptoms are pain, tenderness, swelling, stiffness, and weakness. Tendonitis typically causes a dull ache, especially when moving the affected limb or joint. The affected area may be tender to the touch due to the swelling and inside the joint that it crosses. The affected joint may also feel stiff, particularly in the morning or after periods of inactivity. Sometimes the muscle connected to the affected tendon may feel weak, making daily movements more difficult. Several factors can increase the risk of developing tendonitis, including age, occupation, playing sports, medical conditions, and previous injuries. As people age, their tendons become less flexible and more prone to injury. Tendonitis is more common in individuals over 40. Improper technique and inadequate warm-up or stretching can also contribute to the condition. Certain medical conditions, such as rheumatoid arthritis, diabetes, and gout, can increase the risk of developing tendonitis. Finally, a history of tendon injuries can make tendons more susceptible to inflammation and damage. Treatment for tendonitis typically aims to reduce pain and inflammation and promote healing. Common treatment options are ice, rest, and non-steroidal anti-inflammatory drugs like ibuprofen. Sometimes, a stronger approach, such as physical therapy, injections, or surgery may be needed. A physical therapist can assess your specific needs and make a tailored plan to improve your strength, flexibility, and function in the affected area. Platelet-rich plasma, also called PRP, or corticosteroid injections may be used to reduce severe inflammation.
Thanks for watching. We hope this video has been helpful in your education about the different types of tendonitis. Sometimes it can be challenging to navigate all the treatment options. If you want more information about whether or not physical therapy could be helpful for you, click the link in our description below to watch our video titled "When Should I See a Physical Therapist?" Have a great day. If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.